Hello everyone. Today we will discuss about the next NCLEX practice-based questions. So let's start our first question. The nurse would initiate a protective isolation procedure for a neutropenic 6-year-old child with leukemia receiving combination chemotherapy. Select all that apply. Permit fresh cut flower in the room if they are kept in a vase with fresh water. Change dressing, use sterile techniques. Implement a low bacteria diet for the child. Limit all the visitors' access to the child. Encourage the consumption of fresh fruits and vegetables. Perform the meticulous hand washing before caring of the child. So let's see here, before solving this question, let's have an overview of this MCQ. So it is a SATA based question. And we have to select the multiple options regarding the protective isolation procedure for a neutropenic line. So condition given the neutropenia with the leukemia receiving combination chemotherapy. So main concept here about the neutropenia. So let's solve this MCQ. So what is neutropenia here? Neutropenia means decrease neutrophils. Okay. So neutropenia occur when you have too much few neutrophil, a type of, and what are the neutrophil? Type of the white blood cells. While all the white blood cells help our body to fight the infections, but neutrophils are the important for fighting certain infections. Means basically neutrophils help to fight against the bacterial infection here. So which plays an important role? Means neutrophils plays an important role to fight against the bacterial infections. So with this help of diagram, you can see here, like here the RBCs, neutrophils. So here the normal range, and when the decreased range about the less than the 1500. So it is the condition that is the neutropenia. So neutropenia means the decreased amount of the neutrophils from our body. So which kind of measures we have to use, or which kind of measure RN should use in the protective isolation for the client having the neutropenia with leukemia. So firstly, here the low bacteria diet means the client should be received a low bacteria diet here, providing a nutritious diet. So if we have to maintain the diet chart or maintain the diet of the neutropenic line, so we have to administer the low bacteria diet, means the less contaminated diet for the client. So here you can see here, like, avoid the raw vegetables and the fruits, and avoid the raw and the uncooked meat, because both these things have the higher chances of the contamination. So both these, the unwashed and the raw fruits and vegetables, and raw and uncooked food, means we can't given this to the client, because these can increase the risk of the bacterial contamination. So we would avoid these kind of the diet, means low bacteria diet here. And secondly, we have to administer about the nutritious diet here. So nutritious diet means the diet rich in protein and calorie. So we have to increase the protein and calories in the individual diet. So here the low bacteria diet concept to decrease or minimize the effect of the bacteria. Then here second concept about here, like hand washing before caring of the child and sterile dressing. So hand washing is the main concept, like hand washing can prevent the cross contamination here. So we can say that if the client here, hand washing is the main procedure before doing any procedure to the client. So because hand washing can prevent the cross contaminations, so if there will be the regular hand washing before every procedure, it can decrease the risk of the bacterial contamination and the spreading of the infection to the client. Because like you can see that client is already having the decreased count of the neutrophil, and if there will be no any hand washing before the procedure, so other bacteria can also enter into the client body and also suppress the immune system. So to prevent these conditions, or to prevent or minimize the bacterial contamination, hand washing must be done before the any procedure. And secondly, here the dressing. So you can see here, like the dressing are always changed when the with the sterile techniques, because skincare is provided to keep the patient's skin clean and the moisturized. And the sterile dressing, or the we can say that we would use the aseptic technique, all the aseptic techniques we would use to prevent the child from the infection. So both these are the also important measure. And third important measure is like some consider here, these kind of the measures, like avoid the crowded places, and also here the hand washing, then there the proper hygiene, and gloving or the personal protective equipments we can use. Because already the clients in the neutropenia, there will always the decrease count of the neutrophils. And we know that the neutrophils are the special type of the cells of the WBCs which help to fight against the special bacterial infections. So if there will be the decreased amount here of the neutrophil, so there will always the increased chances of the bacterial infection. Bacterial infections. So by using all these measures, we can prevent the child from the cross contamination and having the infection. So let's see about the right options here. So we have discussed firstly the right options. So option B is the right. Change the dressing using the sterile techniques. So we know that the dressing are always changed with the sterile technique, and through skincare is the provided the patient's skin clean and the moisturized. So B option is right here. C, implement a low bacteria diet for the child. So this is also a right answer, because the child is placed on the low bacteria diet, providing a nutritious diet rich in the protein and calories. But we have to avoid some raw fruits, vegetables, or uncooked meat to minimize the bacterial contamination. So C option is also right. And here, last option F here, perform the meticulous hand washing before caring the child. So this is also the right option here, because hand washing is an important procedure before doing any procedure. So hand washing is the important to prevent the cross contamination in the child, and it can decrease or limit the spread of the bacterial infections. Let's see about the other remaining options. So permit the fresh cut flower in the room if they are kept in a vase with fresh water. So flowers or the plants should not kept in the room, because it can be increased risk of the pseudomonas infection, so which is also can lead to the worsening condition. So A option is inappropriate. Limit all the visitors access to the child. So there is no need to limit all the visitors, because but yes, we have to restrict those individuals who are ill. Means we have to restrict ill individuals. So this option is inappropriate, because here the mentioned word all. So there is no any need to limit all the visitors, but individuals who are ill should not be allowed in the child's room due to the higher or the increased risk of the infections. So D option is also inappropriate. Last option A, encourage the consumption of the fresh fruits and the vegetables. So fruits and vegetables that are not peeled or the fresh should also avoided, because until the WBC count raise. So if there will be like the decreased WBC count, so we can't administer or we can't give the fresh fruits and vegetables before the peeling off, because it can also increase the risk of the infection in the child. So these kind of procedures or the fresh fruits and vegetables should not be given in the client. So option E is also inappropriate. So there are the right option of this MCQ will be B, C, and F. Next question here, MCQ number 2 here next. The medication commonly prescribed for a long-term control of the tonic-clonic seizures. So select all that apply: valproic acid, amphetamines, alprazolam, gabapentin, phenytoin, zirconides, methylphenidine, and carbamazepines. So these are the here some name of the medication. So condition given in the MCQ here means we have to select all that medications. It is also a SATA based question, and we have to select the medications that are used for the long term control of tonic-clonic seizures. So let's solve this MCQ. So here, first drug about the phenytoin. So phenytoin, it is an the anti-epileptic drug. So we all know that the action of phenytoin, so it is the anti-epileptic drug. Okay. And how it works? So we know that phenytoin block the, yes, we know that phenytoin block sodium channels. Okay. So when it block the sodium channels in the brain, so it can help to reduce the seizure activity. Okay. So it can help to reduce the seizure activity. So we can say that we can use the phenytoin drug because it is an anti-epileptic drug. Second here about the carbamazepine. So here carbamazepine, we know. Sorry for the interruption here. So next drug about the carbamazepine. So carbamazepine is also, we know that the action of carbamazepine, it is also an anti-convulsant drug. Okay, so it is also an anti-convulsant drug. So how it works, it also block sodium channels in the brain. And when the sodium channel blocks in the brain, it can help to reduce the seizure activity. Okay, so means we can also use the drug carbamazepine. Next drug here about the gabapentin. So this drug is also the anti-epilepsy drug. So we can also use this drug in the long term of the seizure activity or the tonic-clonic. Next drug here about the like the alprazolam. So alprazolam is anti-anxiety drug. Okay, so we can't use this in the seizure activity here. So also here, and other drug that is the ethosuximide is that is used for managing the absence of the seizure. So here alprazolam is not the appropriate option. So let's see the right options here. Right option here, we know that medications used for the control of tonic-clonic seizures. So option A, valproic acid is the right answer because we have discussed that valproic acid is an anticonvulsant drug. So here, and carbamazepine is also the right options. These both block the sodium channels in the brain that help to reduce the seizure activity. Gabapentin and phenytoins are also the anticonvulsant drugs here. And ethosuximide also help in the control of the long-term absence seizure. So option A, option D, option E, F and H are the right option here. And we have discussed about that is alprazolam. This is not the here the anticonvulsant drug, because this drug is used for the treatment of the anxiety. So it is an inappropriate option here. Then next here the option amphetamine. This is also an inappropriate option, because this drug is not used to treat the tonic-clonic seizure activity. So remaining options are not the right options here, because these are inappropriate. And valproic acid, gabapentin, phenytoin, ethosuximide and carbamazepines, these are the right options here that help to treat the long-term control of tonic-clonic seizures. So this is about the today's question here.